and Brandon Guskowski. Throughout my life, I've noticed that I am hyperactive, do things out of impulse most of the time, and get distracted very easily. And you notice I mostly have these problems when I'm in class. I can't sit still in my seat. I'm always playing with something like my pens, and I look around a lot and have many distractions in the room. It wasn't until past January that my father, John Guskowski, took me to the doctor. Then, when I went there, I was diagnosed with attention deficit disorder, which is also known as ADD. Since I was diagnosed with ADD last month, I have done a lot of research on this topic to learn how exactly it is affecting me and how I could overcome it. So today I'd like to talk to you and teach you guys a little bit about how doctors diagnose you with ADD, the different ways they affect you, and how it can be treated. Many people often confuse ADD with just the lack of the will to pay attention. According to ADDFactsheet.com, the definition of ADD is someone who commonly struggles with three characteristics like I often do. One is distractibility, which means you cannot stay focused on the task at hand no matter how hard you try. Two is impulsivity, which is when you do random things out of impulse. And three is hyperactivity, which is the physical restlessness and unnecessary activities such as playing with your pen while trying to pay attention. And I also got those definitions from ADDFactsheet.com. Since these characteristics were kind of broad, I decided it would be best to talk a little about how the doctor diagnoses someone with ADD. Because according to naturalnews.com, only 4 to 6% of the adult population has ADD. I had a checkup with my doctor, Scott Parker, at Vanderbilt Medical Center in Franklin yesterday. So I was there. I decided to interview him and ask him how exactly he diagnoses his patients with ADD. He said to start, he has a patient describe their issues and compare them to the Diagnostic and Statistical Manual of Mental Disorders, which lists things for such as the failure to give close attention and detail, does not follow directly, clearly, and closely to any directions they are given. They forget important things quite often, and a lot of fidgeting with their hands or feet. Dr. Parker also said he likes to go around and gather information from many different sources, such as the patient's family, friends, and teachers, to see how they are affected in different environments. When he gets this information, he likes to compare the behaviors he has described with people from the same age group and see how they're different. The last thing he looks at is your family's past medical history. He looks at things such as sudden life changes, if you've had sleeping problems, anxiety, or any depression problems. If you are visit a doctor and they do diagnose you with ADD, the next thing you need to do is learn how you can be treated. There are three main ways you can treat ADD, and the mostly are medication, which helps normalize your brain activity. Some examples of this would be Ritalin and Adderall. The next one is therapy, which helps modify your behavior, and it helps with the emotional aspect of ADD, which could be many different things, such as like why you can't concentrate and what's really on your mind. And last is counseling, where you can learn many different coping skills and how to adapt your behaviors and change so you can pay more attention, and it'll help you a lot. So in conclusion, to diagnose ADD, you have to visit a doctor, and doctors compare your actions to others in your age, and they look at all the symptoms, and they also look at family and medical history. And if you are diagnosed, luckily there are multiple treatment options where you can help you focus on your hyperactivity. The three main ones being medication, therapy, and counseling. And a good website you can go to is add.org, and you can learn about a lot about ADD and how it affects you and how you can overcome it. And ever since I've been diagnosed and I now have medication, I haven't gone to counseling or anything because the medication seems to work pretty well, but it has helped me improve with my schoolwork, at my job, and just with everything I do around the house.